Hi everyone, I'm Danielle Donato, Community Liaison for Centers Healthcare, and I am joined today with Kristen Sportello. She is one of the amazing registered dietitians at Schenectady Center. Welcome, Kristen. How are you?
Good, how are you?
Good. Thank you so much for joining me today. We know you're busy, so we're going to get right to it. And I have a few questions. We're going to do a brief dive into the dietary department and nutrition in a skilled nursing facility. So, Kristen, in your own words, what is the importance of a dietary department in a skilled nursing facility?
So in a skilled nursing facility, the dietary department plays a crucial role in all residents' lives here as they stay with us. So it stems from the people in the kitchen that are preparing the food all the way until myself, the dietitian, and my coworkers who are also dietitians and registered diet technicians. So we are constantly monitoring every resident. We look at everything that they have, encompassing that their time here. So we look at their medical diagnoses, we look at their labs, we look at their preferences, we look at their diet history. Pretty much everything that they have going on, we are considering in our plan of care, our individualized plan of care for every resident.
Very nice. It's good that everyone works together to build that plan of care for the patients and make sure that they're healthy and happy with their decisions for dietary, for food choices. So I know there are quite a few different diets, and when it comes to medical nutrition, so I'm just curious, what types of diets do you come across on a daily basis?
So we encounter a lot of different diets that are patient specific to their preferences, but we also deal with a lot of therapeutic diets. So a therapeutic diet is an evidence-based medical approach to treating certain chronic conditions through individually tailored nutrition plans. So we have set therapeutic diets here, which include diets specific to people with diabetes, hypertension, heart failure, chronic kidney disease. And then we also deal with patients who come in and have cultural preferences. So we have people that are vegan, we have people that are gluten-free, lactose-restricted. We pretty much see everything. We even have, people that are not vegan but they're vegetarian. So we alter based on whatever, the patient comes in and is really wanting us to do for them.
Wonderful. So it's actually one of my questions is realistically there are so many different lifestyle habits and cultures, religions, traditions, or just requests that people have. So how do you accommodate all of that?
So typically when a patient comes into our facility, we meet with them within the first 24 to 48 hours. And really our goal in that time is to get their diet history medically, but we also culturally in their preferences, we want to know exactly what they need. We want to know, what are some things that you like to eat at home that, we can kind of translate to here. A lot of the times we see people with decreased appetites, so it's really important for us to make sure that we're diving in and saying, what is it that you need? What do you like? What don't you like? What can we remove? What can we add? What can we give double of? Or what can we, anything that we need to do for that patient. That we have, foods that we have available in the facility to accommodate their needs.
Nice. So that, kind of brings me to my last question. I wonder the interventions that you take, as you said, you walk in knowing or asking these questions, what are your interests, or you look at their calories. There's so many different things that come into play, but, there's also different things like struggling with chewing and swallowing, and you have a lot of different interventions. And how do you go about helping a patient that maybe needs more calories, less calories, is struggling with chewing and swallowing?
So again, in our first initial assessment, we're gathering all of that information. So typically our interventions would include, for example, someone who might want to lose weight if their BMI is very high and they have diseases that are complicated or related to that. We would meet with them and say, what is your goal? What type of lifestyle change are you ready for at this point? And that may be meeting with them weekly to provide diet education. That may be decreasing portion sizes on their trays as they're agreeable to that. We like to make sure that any intervention that we're doing, the family and the patient is aware and agreeable to that intervention. For our lower body weight patients that may need extra calories, we can have fortified foods, we have supplements. We always try to do food first, so we encourage the resident to, what can we add physically on the tray as opposed to a commercial supplement or something like that. We also encounter a lot of wounds, which require increased protein needs, so that is where our commercial supplements typically come into play. Or, for example, double their egg entree at breakfast time, or adding, an extra ice cream at dinner. Pretty much any type of nutrition related goal that someone has, we can conjure up a intervention for them, for sure.
It seems so, and I really thank you. This is a lot of information in a short period of time. It's great. It gets everyone to learn a little bit more about the dietary department, what you do, what we do here at Schenectady Center and at all of our centers with Centers Healthcare, and how we accommodate our patients. So thank you so much for joining me today. If you would like to learn a little bit more about Schenectady Center or any of our Centers Healthcare skilled nursing facilities, you can call the number on your screen and we'll connect you with the center's liaison, and we'll give you more information about what services we have, what facilities we have. And thank you again so much, and
You're welcome.
have a great day, and until next time everyone, thank you.